Ancient Egypt is remembered for its pyramids, temples, and incredible advances in medicine. But the reality was far darker. While Egyptians made remarkable discoveries in anatomy and surgery, many of their treatments were strange, terrifying, and sometimes deadly. Disease was feared as a manifestation of divine wrath. Illness was often blamed on angry gods, malevolent spirits, or curses. Doctors, known as swoon, were part physician, part priest, and part magician. Healing involved a combination of practical treatments, ritualistic ceremonies, and magical incantations. Medicine and superstition were inseparable, and the line between cure and punishment was thin. Some remedies were horrifying by modern standards. Infections were treated with honey and animal dung. Wounds were cleansed with moldy bread or ground minerals. Cauterization and trepanation were performed to release evil spirits from the body. Amputations, while rare, were sometimes carried out without anesthesia. Even powerful pharaohs subjected themselves to these brutal practices in the hope of divine healing. Herbal remedies were common, but they could be lethal if misused. Poppy seeds for pain, mandrake for sedation, and castor oil for cleansing were standard treatments. Yet dosages were often inconsistent, and trial and error experimentation could easily kill. Some cures involved the blood or fat of animals, combined with chants and prayers to invoke healing from the gods. Magic was ever present in medical practice. Amulets were worn to ward off disease, spells were recited over the sick, and offerings were made to deities such as Sekhmet, the goddess of plague and healing. The doctor's role was as much spiritual as physical. Without proper ritual, even the most skilled physician risked failure or the wrath of supernatural forces. Surgery, though advanced in some ways, was terrifying. Trepanation, drilling holes into the skull, was sometimes performed to release evil spirits or relieve headaches. Infections could be worsened, and without antiseptics, mortality was high. Bones were set, wounds sutured with linen. But even these careful measures could lead to horrifying complications. Even childbirth carried risks. Midwives often used magical spells and amulets to protect mother and child. Herbal potions and ritual baths were employed. Yet mortality rates remained high. Infants were sometimes treated with charms rather than medicine, and mothers suffered without adequate pain relief. The most frightening treatments were reserved for severe illnesses believed to be caused by supernatural forces. Spells, incantations, and even symbolic rituals were used to exorcise disease from the body. Priests might recite hours of prayers, burn incense, and use ritual knives in symbolic gestures intended to drive out evil. Sometimes the patient's body was manipulated or struck as part of the ritual, blurring the line between medicine and punishment. Doctors documented their treatments in papyri, such as the Ebers Papyrus and the Edwin Smith Papyrus. These texts reveal a combination of observation, superstition, and brutal experimentation. Treatments ranged from herbal remedies and surgical techniques to chants, amulets, and even painful procedures intended to shock the body back into health. Despite the dangers, Egyptian medicine could be surprisingly effective. Wounds were cleaned, fractures set, and some infections treated successfully. But the fear of gods, demons, and curses permeated every procedure, turning even routine treatments into rituals of terror. The line between medicine and magic in ancient Egypt was dangerously thin. Doctors were also priests, and every treatment was as much a spiritual ritual as a medical procedure. Severe illnesses were often believed to be caused by evil spirits or divine punishment. Curses could manifest as fevers, infections, or sudden paralysis, and only through ritual, amulets, or incantations could they be cured. Some procedures were terrifying by modern standards. Bloodletting was used to release toxins or evil forces. Herbal poultices containing animal fats, snake venom, or ground minerals were applied to burns and wounds. Patients sometimes had to endure ritualistic striking or cutting, symbolic acts to drive out the disease. Even something as simple as a fever could result in hours of chants, incense, and exorcism-like interventions before any herbal remedy was applied. Surgery was primitive and brutal. Trepanation, or drilling holes into the skull, was performed to release evil spirits or alleviate pain. Without anesthesia or antiseptics, many patients died during or after the procedure. Yet these practices were recorded and refined in texts such as the Edwin Smith Papyrus, showing that Egyptian physicians combined observation with trial and error experimentation, often at the patient's expense. Childbirth was another scene of terrifying treatments. Midwives employed both practical methods and ritualistic practices. Potions, incantations, and protective amulets were used to safeguard mother and child. Sometimes herbs induced labor forcefully, while rituals were performed to exorcise evil spirits that threatened the newborn. Infant and maternal mortality rates were high. Despite these interventions, the fear of supernatural influence always guided the process. Even routine illnesses could result in bizarre treatments. Diarrhea, coughs, and infections were treated with mixtures of animal dung, honey, or plant extracts, combined with chants and prayers. Spells were inscribed on papyrus or amulets worn around the body to protect against further disease. A patient's survival often depended as much on belief and ritual as on the effectiveness of the remedy.
Some of the most horrifying practices involved the deliberate use of toxins. Venomous snakes, poisonous plants, and mineral compounds were employed both for healing and for punishment. A carefully measured dose could cure, while an error could kill. This was a world where medicine and magic were inseparable, and danger lurked in every treatment. Amulets, spells, and ritual objects were ubiquitous in Egyptian healthcare. Patients wore charms to protect themselves from infection or spiritual harm. Priests recited incantations over wounds, imbued salves with sacred words, and performed ceremonies to maintain harmony between body, soul, and the gods. Even the most advanced medical procedure was incomplete without the blessing of divine forces. The dead were not spared these practices. Mummification itself was a medical and magical process. Preservation of the body required precise removal of organs, desiccation, and wrapping, combined with spells, amulets, and rituals to ensure the deceased's survival in the afterlife. Any misstep could imperil the soul, while the presence of magic and sacred protection ensured that even death required obedience to divine and medical authority. Ancient Egyptian medicine was therefore a terrifying mixture of science, superstition, and ritualized brutality. Healing was never purely physical. It was a spiritual negotiation with gods, spirits, and unseen forces. Patients faced not only disease, but the constant threat of the supernatural, an ever-present fear that dictated how treatments were performed and how lives were saved or lost. And yet, despite the horrors, Egyptian physicians achieved remarkable feats. Fractures were set,
wounds healed, and some diseases were treated successfully. But every cure came with risk, every ritual carried weight, and every treatment reflected the omnipresent fear of the unseen, of gods, demons, and the consequences of displeasing either. In ancient Egypt, medicine was a delicate balance of knowledge and terror. It combined practical observation with magical protection, life-saving remedies with rituals of fear, and healing with the constant awareness of divine oversight. To be a patient was to submit not only to the skill of the physician, but to the gods themselves, a world where health, survival, and death were intertwined with mystery, ritual, and horror.